Hi. Later on today, I'm going to be having a knee surgery. It's actually the first of two. I have the same condition in both knees, in that I have no cartilage left on the underside of my patella. So the procedure I'm having is a patella femoral resurface, where they put a plastic button underneath the patella to be the new cartilage, and a plate on the trochlea. When I was researching this particular procedure, I found there was lots of video of people's recovery from total knee replacements, but very, very little of this particular procedure because it's less common. So I thought I'd document what it's like. So next time you see me, it will be hopefully day one, and we'll see what the first day looks like in terms of mobility, swelling and all that sort of stuff. So I'll see you on the flip side. Okay, it's 4:30 on operation day in the afternoon. Surgery completed about 2. So I just thought I'd capture a quick update on what it's all like. So at the moment, pain's okay. And I'll just show you how much I can move my leg already. As you can see, I think I could go higher than more than that, but they've told me not to move it until I've seen the physio too much. So, but you know, it's more moving than I was expecting so soon off the operation. It's only been an hour and a half since I got back from the recovery ward. So I'll do a day one video tomorrow once the physios have been in and stuff. So see you next time. We're now day after the operation. Things are going pretty well. It's not too painful. I'm getting away with just paracetamol and codeine for pain relief. Actually got a decent night's sleep, surprisingly, as well. Physio's just been around and signed me off, so didn't need the walking frame, straight onto crutches, and walked up and down the corridor, up and down some stairs and stuff like that. So all's going well. I'll show you some of the movement that I've got in it on day one in a sec, and I should be going home tomorrow. Here's the unbandaged leg. You can see it's pretty bruised, a bit swollen. Got fairly good movement actually. It's not too painful to move it. It's just a bit restricted with the swelling and stuff and the soft tissue damage. Hi there. Monday morning, so it's day 3 after the operation. Back at home, came back yesterday from the hospital. So just thought I'd do a bit of an update on how things are going. The knee's actually releasing all the time. Actually, it's feeling quite good. I'm moving around the house pretty good on the crutches. Didn't wake up in the night with requiring sort of painkillers like I did the night before and the night before that. So I'm still just on paracetamol and codeine. Haven't needed anything stronger than that. And actually the pain is getting less and less, I'd say. And the movement's definitely coming back. So I'm about to do my physio exercises and see how that's going. The other things I just thought I'd mention is I did some sort of preparations before the operation. I'll do another video about this Polar Wave machine that I got, which I used for the first time last night, and it was really good. It does sort of compression and cold, and unlike the ice wraps, you can leave it on for an awful lot longer. So it was very helpful for keeping the swelling down and generally the pain management. The other things that I did is I got a couple of sort of vacuum seal hand grabs, which one I put in the shower this morning. Didn't really need to use it to to brace myself or anything, but it's just handy to have something to help balance whilst you're pretty much on one leg. But the shower went pretty well actually, and I got a kind of cast bandage cover to go over the wound, so you can just shower normally, and without risk of that getting all wet and having to be replaced, which they have told me not to do. So that's it for now, and I'll do some more videos of it later. So it's now Tuesday afternoon, so we're 4 days after the operation. I have to say things are going pretty well. The movement's definitely coming back. I mean, I can lift up my leg now. I can straighten it. Still pretty restricted on sort of the bend. It tightens up over here and where the muscles are still quite tight. I suspect a lot of that is the wound and the dressing, which will come off next Tuesday now. Walking around is much better. In fact, I'm starting to be able to walk around without the crutch. So I think it'll only be a few more days really, for certainly around the house. I'll be able to walk around without the crutches, and probably another few days after that for things like stairs. I'm not going to push it with those sorts of things. Other little bits and pieces. Getting dressed was a lot quicker this morning. Yesterday it took me about 5 minutes to get my right sock on, and that was about 1 minute today, so it was a lot easier. I think that's just because I could move my leg a little bit more. And generally putting trousers on and that sort of stuff is a ton easier than it was. Done another walk with the dog today. Luckily our dog doesn't pull on a lead very much, so pretty safe going for a walk, and that's good. So I did about 2 kilometers today. No reaction. I've started to cut back on the pain meds now as well. So just on paracetamol now. I've dropped the codeine as of this morning. It's making my stomach feel a bit weird, which I know is one of the things that it does. But the pain's as such that I don't think I need that extra anymore, so just aspirin and paracetamol. So all in all, pretty good. I think good progress. Wednesday, day 5 after the surgery. Boy, it was an interesting night. All day yesterday after the last video, I could feel sort of a tenderness that had been there since the beginning, but I could feel it sort of creeping up the leg all the way up to here, and just felt like a dead leg. And overnight, that really became quite intense, and it was that kind of really sort of intense healing pain that you feel, rather than, you know, when you first injure a muscle it hurts when you move it. This is just hurting all the time, and it's a lot better right now, but last night was pretty interesting. And I realised when I was awake in the middle of the night that it's probably where they during the operation had the tourniquet across the top here to restrict the blood flow. That must have been on pretty tight for an hour or so. I reckon that's sort of bruised. So you know, I think it's probably the muscles kicking back into life, and I can definitely feel it getting better. So hopefully that will be an improvement. I just have tried to spin the exercise bike I got for the recuperation from this. Although I can't do a full revolution with this leg, what I can do is sort of go to the max and use the other foot to just put a little bit of pressure in to try and move it. It's quite a gentle way to try and increase the range of motion and push the stretch in the quads. Other than that, everything's still going pretty well, I think, and hopefully things will continue as they have been. Okay, so it's day 5, so Thursday after the operation now. I think I said in yesterday's update, that night was quite challenging with pain. I didn't sleep very well. So last night I went to bed pretty early. Went back on the codeine just for the evening, and then slept through to about 1, and then woke up with the sort of whole quad area, sort of hot, dull pain, or almost kind of a real sort of fire burning in it. It's that kind of pain that you get when the muscle's just repairing itself if you have had bad injuries and stuff in the past. So it's quite intense. And luckily I'd watched a video of a guy that had a total knee replacement who had a different type, but it was one of the cryo cuff type machines, and he'd been sleeping with it. So I thought, okay, so I did that. I put it on as I just had it on cool mode, and it really did help with the pain. So, you know, for 300 quid investment with 2 knees to do, that is a really good investment. It was absolutely fine. It's pretty quiet, so it didn't really disturb me during in the night. Certainly a lot less than the pain was. So it worked really well. So we'll see how that continues. So I've got the follow-up appointment next Tuesday. So heading down to Bristol to do that. Well, hopefully the dressing is going to come off. And in terms of movement, I mean, I'm getting, well, you can see I haven't got the crutches in the house at the minute, so I'm getting pretty good movement. I think the dressing is actually now the thing that's really restricting, so it's going across there, so I feel I can push it a little bit more, but the dressing is stopping it, so don't really want to mess with that too much. And yeah, I'm about to go for a walk. I've just been waiting for it to get into the positives. You can see it's nice and sunny outside by the sun, but it was -2, and so it's just gone into the positives. So I'll go out for a walk with the dog, and hopefully keep it moving and keep this recovery going. So thanks very much. See you. Hi there. So it's Friday. 1 week after the first operation. Things are continuing to progress. Movement's definitely getting better. I can now actually really lift my legs, where I've been sort of hooking my leg with my other leg to get into bed and stuff like that. I can now actually lift it. It's a little bit painful to do it, but I can do it now, which I couldn't until this morning. The other thing I've really noticed is the bruising is really becoming visible in sort of the non-operating site. So around here, where I guess the tourniquet was, and I can see it down here, and into my foot as well. Actually, I can see there's bruising there too. Other than that, everything is going pretty well, and hopefully I'll get a good sign off from the hospital on Tuesday when I go back.